Welcome to Alliant Health Solutions Bite-Sized Learning on What is Counseling and Telehealth? Part 2, Telemental Health. There are times when we reach out for help, but all types of barriers can make it difficult to access. That's where telemental health comes in. Maybe you're homebound, don't have transportation, or are nervous about going to see a counselor. The pandemic has made it easier for people to access services through telemental health. Alliant, as a strategic partner in the National COVID-19 Resiliency Network, is pleased to collaborate with Timothy Ean, a doctoral student in counselor education and school psychology at the University of Central Florida. Let's listen in as Timothy shares what telemental health is, what to expect, its advantages, and the wonderful ways it can help support us when we need it the most. Here's Timothy.
What to expect in counseling and telehealth, Part 2, Telemental Health. So you're interested in counseling, but are homebound, have barriers such as distance or limited transportation, or are fearful of showing up publicly to receive therapy. Fortunately, telemental health options have still allowed people to receive mental health services despite some of these challenges. Telemental health is a behavioral health care that is delivered through electronic communication or video technology. It is allowed for people to have virtual visits in real time through a smartphone, computer, or tablet, and has been a reliable alternative to in-person therapy. Telemental health is not new. In 1959, the US government channeled millions of dollars towards expanding services to help people living in rural areas. More recently, the pandemic, along with other factors such as research and improvements to technology, have led to a growth and popularity in telemental health services. There are many advantages of telemental health. To start, it can be a cost-effective method that expands the reach of services to geographically remote areas. Additionally, there is no commute involved, which allows for greater flexibility for you to determine where and what time you want to receive services. While limitations do exist, telemental health has risks to confidentiality if the client is unable to provide a private, safe space in their own home. Other barriers and challenges arise if there is limited access to or failures in technology. To prepare for telemental health, start by ensuring that you have a quiet, confidential space. You may have to inform household members not to interrupt or disturb, and also consider keeping your phone, tablet, or computer charged, dressing appropriately, and using headphones for enhanced sound quality and privacy. Lastly, as you begin to prepare for your telemental health visit, it's important to know that you can expect your counselor to review the risks and benefits of telemental health, as well as an emergency phone number or physical address for your safety. Your counselor will never keep any recordings and outline any further agreements in your first session.
Thank you for listening. Join us for Part 3, Preparing for Your First Counseling Session.